Hello everyone, I am Dr. Parvez Ahmad. Today I am going to talk about the drugs used in congestive heart failure. First we understand what the mean by heart failure. That means heart is unable to pump to meet the metabolic demand of the body, that is called heart failure. Okay. So, here we have used different type of drugs. First one is called drugs with positive inotropic effect. What the mean by positive inotropic effect? Means the drugs which increase the force of the contraction of heart, that is called positive inotropic effect. Now, different type of the drugs which increase the force of the contraction of heart. First one is called cardiac glycoside. Why it is called cardiac glycoside? Because the chemically is glycosidic in nature and they act on the heart, that is why called cardiac glycosides. Now, examples of the cardiac glycosides are digoxin, second one digitoxin. Okay. Now, collectively known as digitalis, because these are drugs which are obtained from a plant is called digitalis purpurea. Now, second categories of the drug is called phosphodiesterase inhibitors. Examples are milrinone and inamirinon. Okay. Now, third categories of the drug is called beta receptor adrenergic agonist. Okay. Examples are dobutamine and dopamine. Okay. So, these all are drugs we have used in case of acute heart failure. Okay. Now, second categories of the drugs we have mainly you have used in case of chronic heart failure, and second category of the drug is called drugs without positive inotropic effect. That means, these categories of the drug which inhibit the compensatory mechanism has been given by the God. Okay. In case of the heart failure, the God has given a compensatory mechanism. Okay. That means the increase the systolic force of the contraction. Okay. Increase the systole. Okay. And by increasing the sympathetic activity, by releasing the noradrenaline. We know that in a heart, in myocardium, beta 1 receptor is there. Now, God has given the, we know that God has given the compensatory mechanism by release the noradrenaline. This noradrenaline combined with beta 1 receptor which are present on the heart and increase the force of contractions. Okay. More systole is there. Okay. But these are the good things, but two other bad things happen in compensatory mechanism. First one, we know that alpha receptor which are present in a blood vessels. Okay. And it lead to vasoconstrictions. Okay. Now, next one is the, we know that beta 1 receptor also present in a juxtaglomerular cells of the kidney, and which increase the renin secretion, and this renin help to conversion of angiotensinogen to angiotensin 1, and we know that angiotensin 1 is a potent vasoconstrictor, and angiotensin 1 convert into angiotensin 2, and angiotensin 2 also is responsible for the hypertrophy of the ventricles. Okay. And this collectively increase the preload and afterload of the heart. Okay. So, our second categories of the drugs which inhibit the preload and afterload. Okay. By now, the examples of the these categories of the drug, first one is a diuretics. We know that diuretics means these are drugs which increase the sodium in water and decrease the blood volume. Okay. And now, examples of the diuretics are furosemide, indapamide, hydrochlorothiazide. So many drugs are available nowadays in the market. Now, second category of the drug in this category is the ACE inhibitor, okay, like enalapril, captopril. Now, next categories of the drug in this category is the angiotensin receptor blocker ARB, like Alsartan, Telmisartan. Now, next category is the beta 1 adrenoreceptor antagonist like metoprolol. Now, next one is the vasodilators we have used like GTN, glyceryl trinitrate. Nesretide is a newer drugs. Now, next one is a and last one is a vasopressin receptor antagonist is a newer drugs like Conivaptan and Tolvaptan. Okay. So, these all are the complete classification of the drugs we have used in case of congestive heart failure. Okay, thank you.